In more health news, a survey found close to 75% of facial plastic surgeons actually saw an increase in patients under 30 who wanted more cosmetic surgery or injectables. That's according to the American Academy of Facial Plastic and Reconstructive Surgery. But experts say what many Gen Zers don't realize is that Botox actually has to be done regularly over time to maintain those results, and those rounds, well, they can be very costly, but also change your face if it's not done right. So joining me now is dermatologist Dr. Elika Hoss with the Mayo Clinic. Elika, when I saw this study, it was very alarming because on top of this study, it actually says that people can even develop a resistance to Botox. Explain that.
Yes, so Botox resistance is very, very rare, but now that we use Botox frequently for cosmetic purposes and medical purposes like migraines, increased sweating, TMJ, if patients are getting a lot of Botox from different providers at different intervals and they're getting a frequent exposure to it, that would increase the risk of resistance. So I tell patients to try to coordinate appointments between their neurologist and their cosmetic dermatologist and try to have the body exposed to Botox only as frequent as every 3 months.
Okay, got it. So explain what Botox is and how does it work?
Yes, so Botox is a brand name for botulinum toxin type A. There's a lot of different brands. There's Daxxify, Dysport, Jeuveau, Xeomin. So Botox is kind of the household term, but it's not the only brand. What Botox does is it causes a temporary muscle paralysis of localized muscles where we're injecting it. So for cosmetic purposes, we often inject the frown lines, so we call these the 11s, the forehead lines, or the lines around the eyes. And the goal with Botox is just to soften these muscles that can make us look angry or tired or a little bit older. If we just soften them, then you can look a little bit rested and relaxed without looking done. It's actually very, very subtle.
Okay, we hear a lot though about baby Botox. I've heard that before, that you gotta start young, that's kind of partly the problem of this study too. So, I mean, should people be getting baby Botox though?
Yes, so the term baby Botox is actually coined to describe using smaller amounts of Botox, not necessarily doing it at a younger age, but using smaller amounts to prevent the lines from getting very deep. When lines get very deep, like the lines between the brows or the forehead lines, they're very difficult to treat, almost impossible to treat. So now when people see that they frown a lot or they're very expressive with their upper face and they're starting to see some lines form, sprinkling in a little Botox, even once to twice a year, can soften that movement so the lines don't get deep and etched in.
Okay, so what are the risks though?
So the risks with baby Botox and traditional Botox are the same. There's a little bit of pain with injection, maybe a little bruising. Of course, if it's not done properly, you can have asymmetry, unnatural results, that kind of Spock or raised eyebrow. But those things can be corrected if you're under the care of a provider that really is trained in the procedure and knows how to do it well.
When you talk about the resistance though, can that also happen with older folks too?
It doesn't really have to do with age. The main thing is overexposure and then high doses. And I think when we're using it for medical purposes, this is actually a bigger risk than the cosmetic Botox that is being done because the amount of units being used can be very high, hundreds of units or over 100 units. And if you're getting it frequently, that's the main concern. So what I tell patients is, don't get your cosmetic Botox and say, just do my eyes this week and then do my frown the next week and I need a touch up because my forehead's moving again. You don't want to do this every 2 weeks because your body keeps getting exposed and that's what increases the risk for resistance.
Okay, so bottom line, are you talking 3 to 4 months?
3 to 4 months.
Okay.
Every now and then we'll say, okay, you have like a social event, we'll do it at 2.5.
Yeah.
But we generally say, try to keep it at 3 months. If it hasn't worn off completely, don't keep kind of topping it off.
Oh, good advice. All right, Elika, thank you so very much. Rachel?
Ladies, thank you.